Welcome back. For those living with depression and who haven't found respite with the treatments they've tried, it's tough. If standard treatments aren't doing the trick, a non-invasive procedure called transcranial magnetic stimulation might do the trick. The procedure is offered at Montevista Behavioral Hospital, and Dr. Jamie Saishon, she's here to talk more about it. It's great having you.
Thank you so much.
It almost sounds like Iron Man, like next level future stuff. Transcranial magnetic stimulation. What exactly is this?
So it's very similar to an MRI. It's basically we're putting a magnetic field over areas of the brain where there's less activity. We know that there's less activity in depression, and we're kind of inducing those neurons in the brain to be more active, shaking it up a little bit so that hopefully people will achieve a better remission rate for their depression.
Sometimes we see some, you walk through the mall, hey, here's a bracelet, it has a magnet in it, it's going to make you and obviously a lot of that can be snake oil. This sounds like crazy science, but this is real stuff. This has been around since the 80s and it's been found clinically to actually have some great results.
Yes, it's been around for a while, but actually now people have really started to turn to other options besides medications. You can even do this with medications. We know that depression is a chemical imbalance in the brain, that there's something with the neurotransmitters. This kind of looks at that a level deeper because we're actually activating the neurons so that they might release more neurotransmitters. And we know that certain areas of the brain are less active in depression, particularly the front of this area of the brain. And we also know that there's less flow of electricity and that's one of the problems with depression. That's why people have problems with working memory. They have trouble with issues with attention, with concentration. And all that is kind of involved in this major executive functioning area. And TMS allows us to target that specifically.
And this is really kind of like jump starting the brain to kind of work for you again. Who's a great candidate for this procedure?
Anybody who's been on antidepressants and not achieved remission for antidepressants, anybody who can't tolerate antidepressants, people with a history of depression, basically anybody that can come and commit to coming to the hospital 5 days a week for treatment. It's about 19 to 37 minutes. You could do it on your lunch break. It's
painful?
No, it's non-invasive. It's not painful. Some patients have a slight headache, but other than that, no major side effects. And people who just want to get better. It's a tool to help you get better. Is
this 5 days a week for the rest of your life? How long does this last?
It's about 20 to 30 treatments. We say plan on 5 days a week for about 4 weeks.
Side effects to this, other than the headaches, anything beyond that?
There are some rare side effects like a seizure. And if you have any metal, you need to have an evaluation.
Many metal plates in your head, let them know, of course.
But other than that, no major side effects.
Gotcha. Is this something that's covered by insurance yet or no?
Yes.
It is?
The TMS is covered by most insurance plans.
Great.
And if you have any questions about an evaluation, we also can refer you to our outpatient practice, Alliance Mental Health Specialist at 702-485-2100. And we can also do an assessment at Montevista.
So that is how you would get the ball rolling on something like this. If you say, you know, this medication, it's not really doing the trick. I'd like to try something new that's not necessarily another pill. That's how you would get the ball rolling.
Yes, and you can still stay on your antidepressants if they're not working enough for you. This is an augmentation therapy as well. So patients, some of them have chosen to do both.
Absolutely. You've been with Montevista for a bit now. The results you've seen, pretty remarkable?
Yes, we've had great results with all the patients. They all tell us how easy it was to do, how few side effects they've had, and how well they're doing.
Absolutely.
We're even starting to expand. There's the opportunity to treat PTSD, anxiety disorders, more than just depression.
I'm assuming a lot of that probably comes from the same sector of the brain as well.
Yes.
Awesome. Well, it really is incredible stuff, and it's great to get to talk to you about it. Thank you, Doctor.
Thank you.
Pleasure.
I appreciate it.
Nails, by the way. You see the nails? The nails are fantastic. I just noticed them. It's a different approach to treating depression. Transcranial magnetic stimulation. It's offered at Montevista Behavioral Hospital. They're located in West Rochelle, which is just off Jones and Flamingo. Their phone number and website are right there on your screen. Montevista Behavioral Hospital, a proud sponsor of the Morning Blend. Stay with us. We'll be back.